it's a cold spot. Biopsy, well, biopsy, the problem with biopsy is that the pathologist is going to diagnose adenoma or FNH based on the presence of bile ducts. So if, let's say, if you do a liver biopsy in this patient with an adenoma and the needle goes in and gets a few bile ducts, the pathologist is going to say, well, this is an FNH, not an adenoma. And vice versa, if you have an FNH and the needle enters in an area that has no bile ducts, the pathologist is going to call it an adenoma. So this is not always helpful. Another maneuver is to observe the patient, especially in patients that were taking birth control pills. You ask him, stop birth control pills and let's follow the lesion. If the lesion gets smaller, then it is likely an adenoma. However, the risk for malignant transformation doesn't go away even when the lesion regresses. And frequently, we are going to end up doing surgery for the diagnosis, and this is the way we are going to find out what's going on with the liver lesion. In general, the adenomas need to be resected. FNHs are left alone. Recently, the addition of new contrast agents to the MRI have improved our accuracy to diagnose liver lesions. I think all of you are familiar with gadoxetate disodium, or what we call Eovist. The contrast, the characteristics of this contrast material is that it is being taken by the hepatocytes. It's being 50% excreted through the bile ducts and 50% in the kidney. So now, instead of a triple phase, you have a quadruple phase MRI. You are going to have a non-contrast arterial phase, venous phase, and the hepatobiliary phase. This is a study showing patients with FNH and hepatic adenomas using MRI with Eovist in the diagnosis, and you can see that the sensitivity increased from standard MRI from 50% to 96%, and in FNH also from 68 to 96%. And also the inconclusive lesions, which were quite a bit using standard MRI, became zero when using MRI with Eovist, as you can see there. This is an example of MRI with Eovist. We see that this is a cold spot in an adenoma, and FNH, you can see enhancement of the parenchyma of the liver lesion. There are several publications that suggest how to approach these patients with special algorithms. If you go this, you do this, then go to the left, again go to the right, then up and down, like we see here. This is another one also, which is more complicated. And now this is another one which also is still more complicated. I recommend to stay with the basics, get a good clinical history, a good radiology, biopsy when necessary, and using this, you are going to be able to diagnose more than 90% of the liver lesions. Thank you very much for your attention.